Hello everyone, we're back on. We are only going to be streaming live on Facebook. We're not going to have the Zoom meeting, so please share this live with others so that they can join us. Thank you to all of those who are viewing. And my name is Sara Gomez, and I'm the Immigration Services Program Manager at South Bronx United. Tonight I wanted to take some time to go over with you all the resources that are currently available in New York City during this time. So if you have questions during this webinar, please utilize the comment section on the live. And my colleague Kartika is going to be monitoring the comments. And at the end, we're going to take about 30 minutes to have a Q&A. Also, I wanted to mention that I will be sending out a copy of this presentation so that anybody who wants to have it available can have that. I've included a lot of resources hyperlinked into the presentation. So afterwards, please, if you would like this presentation, please go on your browser and enter your information if you haven't already at this link, bit.ly/SBU webinar. You can see it at the bottom left of your screen here, bit.ly/SBU webinar. I do have that reminder on a few slides throughout the presentation. Thank you all for being here, and I'm going to go ahead and get started. So today there's a few things that I want to talk about. These are the broad topics: the stimulus bill and unemployment. The second is workers' rights, healthcare, immigration cases, and lastly, I wanted to go through some community resources specific to New York City. Just a couple of notes before we get started. Because COVID-19 is new, we are learning new things every day. And you should stay informed by visiting cdc.gov or nys.gov. You can also call the New York Coronavirus Hotline at 888-364-3065. To remember that not all of the information you may hear from other people or on the internet is true. We're going to cover a lot of topics today, and I'm not going to go into a lot of detail on everything in the interest of time. So I wanted to let everybody know that SBU families can set up an appointment with me to discuss any topic in further detail. Please, if I understand that some of the folks joining us today might not be SBU families and might be from other organizations, please feel free to reach out, and based on capacity, we will also answer your questions or direct you to others who can do that. Like I said, there's going to be a Q&A at the end. Here's all my information. Please take note of it now. It'll also be up at the end. All right, so first I want to talk about the stimulus bill and unemployment. Okay, so the federal stimulus bill is called the CARES Act. I'm sure lots of folks have heard about it already. It's the payment to individuals that's about $1,200. So Trump recently signed an economic relief plan, which includes direct payment to individuals, expanded unemployment coverage, student loan changes, and more. Now, the payments that you might have heard of. Here's a little bit about how those work. So if you earn less than $75,000 a year, the payment to you will be $1,200. That's per adult. Then for every qualifying child, age 16 or under, you would receive $500 more. This is a one-time payment. So this isn't a monthly payment. Right now, it's just a one-time payment that will be distributed to individuals. Married couples with no children who earn $150,000 or less will receive a total of $2,400. And taxpayers filing as head of household will get the full payment if they earned $112,500 or less. Importantly, and unfortunately, you can't receive a stimulus check if you have an ITIN, you need a social security number. The payments are based on income from 2019, but if you haven't filed taxes yet for 2019, then the 2018 income will be what's used. And if you don't know what your income was, you should look at that statement to see what your employer reported to the IRS. In terms of how you would receive the money, if the IRS already has your bank account information, it will transfer the money to you via direct deposit based on the figures it already has. So there's no need to apply. It's you will receive it automatically. Again, like I said, if you haven't filed taxes recently, then you should, at least for 2018. And if anybody's worried about, like if the reason that they haven't filed is perhaps because they're worried about money that they owe to the IRS, they should consult a tax professional so that they can come up with a payment plan so that they can receive the stimulus. You will still get a payment if you're receiving disability, retirement, or unemployment payments already. You'll still get the stimulus payment. Okay, now about the expanded unemployment benefits under the CARES Act. So yeah, benefits have been largely expanded under the stimulus. Those who are unemployed, are partly unemployed, or can't work for a wide variety of coronavirus-related reasons will be more likely to receive benefits. And the amounts will be calculated based on previous income. A little bit about who's covered. Lots of people are covered under this. Part-time workers, gig workers, freelancers, and independent contractors are covered. If you have COVID-19 or need to care for a family member who has it and can't work because of this, you're covered. If you rely on a school, a daycare, or another facility to care for a child, an elderly parent, or another household member so that you can work, and the facility's been shut down because of coronavirus, you are eligible. I'm going to leave this screen up for a moment and help direct a few folks who were on the previous Zoom webinar to our Facebook Live. If you could give me one moment. Okay, thanks for your patience. So a little bit more about the unemployment benefits. Another type of category of people who are covered under this extended package are people who must self-quarantine. Also, if you just started a new job or were about to start a job but then didn't because of COVID-19, you're covered. Previously, under the unemployment regulations, you need to have worked for your employer for a certain period of time in order to be able to collect unemployment. But under this expanded program, you don't need to have worked there for a certain period of time. Okay, you're also covered if you had to quit because you were told to quarantine by a healthcare provider or because your child's daycare closed and you're the primary caregiver. If your job shut down because of coronavirus, you're covered. So something that you wouldn't be covered for is if you can work from home, if you're receiving paid sick leave or paid family leave. Also, for the unemployment benefits, you need to have a social security number to apply for them. The CARES Act also includes what's called the pandemic unemployment compensation. So eligible workers will automatically receive a weekly payment of $600 in addition to the unemployment benefit payment from the state. And this extra payment will be available through July 31st, 2020. Now, the reasoning for that is that because this is a public health crisis and you didn't you know, you needed to stop working because of the public health crisis, the policy was put into place so that workers could get basically the same income on their check that they would have before the pandemic. That's why the federal stimulus also includes an additional payment in addition to what you will receive from the state. And I included a link here at the bottom, frequently asked questions about unemployment benefits. So that's a link that will be available once I send this out afterwards. Here is a flowchart that I think is also helpful to explain who is eligible for benefits and a little bit about the pandemic unemployment assistance. So yeah, up here you'll see if you're eligible for regular unemployment benefits, you should apply. And you'd be eligible to receive them for 39 weeks plus the additional $600 per week. And yeah, this just explains different situations, I think, in an easy to digest way. I'll leave that up for a moment, and also this will hopefully be helpful when I send out afterwards as well. But also, if you're not traditionally eligible for them under this, you probably are. Now, a little bit about how to apply for them. You can apply online. Here's the link, labor.ny.gov/unemployment assistance, or by phone. I would recommend that you do it online. There's a lot of people who are applying right now, so the phone lines are pretty backed up. If you can do it online, that's best. It's important to know that the day on which you apply is based on the first letter of your last name. So if the first letter of your last name is A through F, you should file on Monday. G through N, you file on Tuesdays. And O through Z, you file on Wednesdays. If you missed your day, you can file on Thursday, Friday, or Saturday. Any claim you file, importantly, will be backdated to the date you became unemployed. So if you're eligible, you will be paid for all benefits due. So let's say, for example, you've been unemployed since last week and you didn't apply this week, but you apply next week, you will be paid for all of the days in which you were unemployed. Also important to note are the hours for filing. Here are the hours by phone, and here are the hours online. So by phone, Monday through Thursday from 8 to 7:30, Friday from 8 to 6, and Saturday 7:30 to 8. Online, Monday through Thursday from 7:30 to 7:30 Eastern Time. Friday from 7:30 to 5, Saturday all day, and Sunday until 7. It's important that you start, I would give yourself like an hour and a half, because at 7:30, once it hits 7:30, it won't let you apply after that. It won't let you submit the application. So please take note of those times. Okay, so I wanted to talk about what folks can do if they don't qualify for unemployment benefits, but they are unemployed in this time. Something that everybody can do really is to call their bill collectors and tell them the magic words that your income has been impacted by coronavirus, and ask them about what they're offering. So this includes student loan payments, which have been suspended until September. It also includes internet providers, cell phone providers, credit card payments, any bill collector really. But it's important to know that you won't receive these benefits automatically. You have to call. And like I said, everyone can do this. Also important to know is that New York State has halted evictions statewide due to coronavirus. So if you can't pay your rent this month, you shouldn't be concerned about having eviction proceedings started against you. I'll talk a little bit more detail about that later as well, but that's important to know. Some organizations have also collected money for people who don't qualify for unemployment, specifically for undocumented folks. Many of these funds have already been depleted the last time I checked in with some of these organizations, but it's still worth asking because they're consistently trying to gain more funds for undocumented people and people who don't qualify for unemployment. Here is a list of some organizations, and we have more if you would like to ask. I can send more. Undocu Workers Fund, the One Fair Wage, and the New York State Youth Leadership Council. Last thing is, if you or your children are U.S. citizens or legal permanent residents, you can apply for SNAP, which is food stamps, and cash assistance. Applying for these things does not make you a public charge. That's important to know, because you're filing through your children who are U.S. citizens or legal permanent residents. And you can apply at nyc.gov/accesshra. Okay, now I want to switch into talking about workers' rights. Again, here's a little reminder to please fill out enter your contact information if you would like this presentation at bit.ly/SBU webinar. Okay, so for those who still have to work amidst all of this, if your employer has been deemed essential and you still have to work, you have rights, and there are things which your employer must do to keep you safe. Here's a little bit about some of that. So OSHA standards that are linked to protection against coronavirus. And the reason I formatted it this way is that hopefully you will be able to cite these standards if you believe that your employer is not following them. So that's why I have all of this info here. The first important thing is the general duty clause. It requires that each employer provide each of its employees employment and a place of employment free from recognized hazards that cause or may cause death or serious physical harm to its employees. There's also OSHA standards on personal protective equipment in general industries, which require the use of gloves, eye and face protection, and respiratory protection. When respirators are necessary to protect personnel, employers must implement a comprehensive respiratory protection program in accordance with the respiratory protection standard. Okay, continued. Employers must also protect their workers from exposure to hazardous chemicals used for cleaning and disinfection. I know that a lot of custodial work has been deemed essential, so employers should be aware that common disinfectants and sterilizers could contain dangerous chemicals, and that when workers are exposed to them, employers must comply with the OSHA Hazard Communication Standard, the Personal Protective Equipment Standard, and the other applicable OSHA chemical standards. All right. This is a second piece of legislation that was passed, and it's called, I wanted to talk about, and it's called the Families First Coronavirus Response Act. This is a new protection for workers regardless of their immigration status. It includes 10 days of paid sick leave, 12 weeks of paid family medical leave. The days are available starting yesterday, and they can only be used for COVID-19 related things, which I'll discuss in a bit more detail next. All right, first, about the permitted use of the 10 days of paid sick leave. So again, you're only allowed to use them for COVID-19 related reasons. If you have to isolate or self-quarantine on government orders related to COVID-19 and therefore cannot work, for example, you have to isolate yourself on the orders of your healthcare provider. You're feeling symptoms of COVID-19 and looking for a medical diagnosis. If that's your situation, you're eligible for these 10 days of paid sick leave. Also, if you are caring for another person who is subject to an isolation order, or you must self-quarantine because of a government order or because of your healthcare provider. Also, if you're taking care of your child because their school or daycare is closed, or because the person who normally looks after them is not available because of COVID-19. How you would receive the payment and a little bit about the payment. So for sick days a person takes to care for themselves and rest when sick, they receive their full salary up to a limit of $511 per day, $5,110 total. For sick days taken to care for a sick family member or to care for a child who is home due to school or daycare closings, you would receive 2/3 of your salary with a limit of $200 per day or $2,000 in total. The payment you should receive is never less than minimum wage. Eligibility for this. Employees working for private employers with less than 500 employees, local, state, and federal government employees, employers of health and emergency services have the possibility of not complying with the act if they don't want to, just a note. Now, the second thing that I mentioned is family medical leave, which is different from the first thing, sort of in addition to it. So for this, it's 12 weeks or 90 days of paid time off work for reasons related to the COVID-19 crisis. It covers a time period between March 18th to December 21st. And the days are available immediately, starting yesterday. You can only use these days if you can't work because you need to care for a child under 18 who has their school or daycare closed, or because the person who normally takes care of them isn't available because of COVID-19. You're not paid the first 10 days because it's assumed that on those days you were receiving the paid sick days that I talked about previously. And on the other days, you would receive 2/3 of your salary with a limit of $200 per day. Okay, a little bit about the eligibility for this. The employee needs to have worked for the employer at least 30 days before starting to take the family medical leave. Again, it's for employers with less than 500 employees. Again, local, state, and certain federal government employees are eligible. And again, about the disclaimer that health and emergency services have the possibility of not complying with the act if they don't want to, with the exception that the Department of Labor has the power to give a kind of shelter to small employers with fewer than 50 employees if they can prove that it would jeopardize the survival of their business. Okay, so I wanted to make sure to include this. This is how you can report if your employer is breaking any of these regulations. You can contact the New York City Coronavirus Hotline. Here's the number. You could also call 311, or you could contact the New York State Department of Labor. You could file a complaint online or call them at the 518 number below. I wanted to take a little bit of time to talk about what has been included to help small business owners in the CARES Act as well, because I know some SBU families are small business owners. So the CARES Act includes extended loans for small businesses and 501c3s. Specifically, the Paycheck Protection Program, it was included in this act. And what that includes is forgivable loans if the small business can show that the money is used for payroll, rent, lease, mortgage, and utilities. The loans are administered by the SBA, the Small Business Administration, through certified lenders, and they also created a new process for lenders who aren't SBA certified to become certified quickly. The goal is for small business owners to use relationships with banks that they already have so that get the money to the small business owners as soon as possible. These are available to employers with 500 or less employees. The application opened yesterday, or today, sorry. And for more information on how to apply, you can go to fmaonline.net. They have a helpful guide. And I also included a link to the application right here. And below are two more like FAQs that are helpful if you have further questions. In addition to the federal government's CARE Act program for small businesses, New York City also has specific resources for small businesses. There's two things. One is the Employee Retention Grant Program. And then the second one is the Small Business Continuity Fund, which is first come, first serve. And this one gives loans up to $75,000 to businesses with up to 99 employees. And if you'd like to learn a little bit more, you can call 311 or visit the website here, which also should have the applications, nyc.gov/COVID-19BIZ. All right, the next topic is healthcare. So quickly on how to protect yourself. People have probably heard this, but just to say it. To wash your hands, very important, 20 seconds at least, and to do this often, even if you're just home, and to practice social distancing. So at least 1 meter apart, even when you're just crossing somebody in the street, or if you're going to work on the train, on the bus, in the grocery store, at least 1 meter, so 3 feet, very important. Now, if you're feeling symptomatic, which includes a fever, cough, body aches, or headaches, or difficulty breathing in more serious cases, what you should do is call your healthcare provider. It's very important to call versus going in person. If you go in person to the ER or to your doctor's office and you're feeling symptomatic, you're putting others at risk if you do actually have it. So it's very important to call first and seek the guidance of your medical professional. They will let you know what you should do. You can also call an urgent care in your area, and they will give you guidance on what you should do based on your symptoms. A note about applying for insurance. So if you don't have insurance right now because you lost your job, you didn't have insurance before either, or you want to switch insurance, the New York State of Health Marketplace has opened their enrollment again, starting March 15th, ending May 15th because of COVID-19. Eligibility is income-based, and if you want help applying, the Alliance for Positive Change can help. And you can reach them at 212-645-0875. They're helping folks right now apply. And also, that's a link to their website with more information. Also wanted to talk about what you can do if you don't have a primary care physician or if you don't have health insurance and if you don't qualify for health insurance. So for undocumented folks, again, I'm talking about too. Something you could do is call 311 and ask them to connect you to a medical professional under the Health and Hospitals Network, or you can call the direct line. Here's the number, 844-NYC-4NYC. Another similar program is NYC Care. I've included the number here. And that's low cost or free healthcare for all New Yorkers, regardless of their ability to pay or immigration status. Two other similar things is the Betances Health Center. That's their phone number there. They provide healthcare navigation. They can help people enroll in health insurance. They also have a walk-in clinic. And if you don't have insurance, the fees at the clinic will be adjusted according to income, and they support all immigrants. The Institute for Family Health, they're similar. They also provide primary health care, dental care, counseling, and other service, regardless of immigration status or ability to pay. Below that, I've included a website here, Healthcare Access for Undocumented Folks, which folks can go to, enter their zip code, and it will pull up healthcare providers that serve people who are undocumented. I wanted to state also, importantly, that the governor has directed insurers to waive any cost for obtaining a coronavirus test, and that includes emergency room, urgent care, and office visits. So any health care related to COVID-19, the cost has been waived. There are options for you even if you don't qualify for health insurance. And again, anyone who's low income can get free COVID-19 testing, evaluation, and treatment in New York State, regardless of their immigration status. I wanted to talk a little bit about public charge and medical treatment because this question has come up a bit. So USCIS, Immigration Authority, has made an exception to the new public charge rule so as to not discourage anyone, including immigrants, to receive a COVID-19 test and receive treatment. So if you receive a test or treatment for COVID-19, that will not be counted against you in the context of public charge. Here on the left is an infographic with some more information, and I'll make sure to put the one in English before I send this out to people. All right, so speaking of USCIS, I wanted to talk about updates in the immigration cases world, immigration courts, and such. So there's a lot of information on this slide, but in essence, almost everything with immigration and immigration courts has been halted for now, with the exception of cases where the person is detained. Those cases are still being heard, except for not at Varick Street in New York. So the takeaway here is that if you have, or if you know somebody who has a case in immigration court right now, they need to be sure that their address on file is up to date, because they should be receiving a letter, if they haven't already, letting them know when their next court date has been rescheduled to. They can also check on their status and court date changes by calling this number towards the bottom here, the 1-800 number, or they can check online using their A number. Another important thing to know is that in-person check-ins with ICE have been canceled, but if you check in over the phone, that's still happening, and it's likely that they've just switched to requiring phone check-ins if you were doing it on person. It's important to know. Okay, now moving to the community resources. All right, so a little bit more detail on what's happening with rent in New York. Like I said before, New York State has halted evictions statewide due to coronavirus. They're working on a rent freeze, which would mean that instead of halting payments, but requiring that you pay them at a later time, a freeze would mean that if, for example, you can't pay your rent in April, you wouldn't have to pay it at a later time either. Nevertheless, what's important to know is that you can't be evicted. Your landlord can't take any action against you if you're unable to pay your rent this month. Housing courts are all closed. Also, something that I learned about is that HRA is offering cash assistance or special grants for people who are likely to miss rent due to reduced income as a result of COVID-19. So if your work schedule has been reduced as a result of coronavirus and you can't pay rent, you can apply for a cash assistance special grant to get benefits for an emergency, such as the coronavirus. And here's where you can apply: Access HRA, access.nyc.gov. I wanted to talk a little bit about resources for students. Many companies are offering free Wi-Fi for 60 days. Here's a list of some of them: Spectrum, Comcast, Altus USA, AT&T, Verizon, T-Mobile, and Sprint. You should call and ask them to set that up for you. Also, NYC is distributing iPads to students that they can borrow while learning from home, and there's a link to where you can request one. Also, remote tutoring for those who are learning from home and would like some help. SBU is offering remote tutoring for Academy students, and you can contact us for more information on that, and you should also check Band. We've been sending information there. For non-SBU Academy students, the New York Public Library also has a free tutoring resource, which is really great, available to everybody in New York City. Families with students in kindergarten through 12th grade and who have a library card can access tips, activities, and one-on-one tutors through a new partnership with BrainFuse. Their tutors are available from 2 p.m. to 11 p.m. every day, and that's available in both English and Spanish. Students can also access BrainFuse's videos, activities, and other learning resources 24/7. I think something got cut off here, but if you don't have a library card and you need one, you can get one still, and you can just apply online for that. And they'll give you like a digital code. You don't really need the physical card. Okay, I wanted to talk a little bit also about employment opportunities, because I understand that there's some folks, because of their situations, who aren't working right now but would like to start working. So here are a few places that are currently hiring. Drivers who are TLC licensed can apply for a job through Delivery TLC to help with work related to COVID-19, such as delivering food to older adults. And this pays $15 an hour plus reimbursement for gas and tolls. You can apply on their website. I've included the hyperlink here. Also, another opportunity is at the Brooklyn Navy Yard. This work entails assembling face shields at Navy Yard Dugal Greenhouse. It's $18 an hour, and in order to apply, you should send an email to jobs@bednarcinc.com to get in touch. Next is Aerotech NYC. This position involves conducting fit testing for respirators or masks for hospital employees. That pays $23 an hour, and for any overtime, you would get $34.50 per hour. To apply for that, you should send a resume to this email here, cweisma@aerotech.com, and ask to set up a time to speak. There are a few positions available through Workforce One, which include maintenance workers, moving and storage workers, Fresh Direct personal shoppers, and security guards. And you should apply through Workforce One. I've included the link here. Also, Project Renewal is looking for a custodian. To apply, you can send an email with resume and cover letter to careers@projectrenewal.org. Also, a tip is to look into grocery stores and bodegas who might be hiring in your neighborhood. Also, something to look out for is that SBU is working on a job board where future opportunities will be available. So please look out for that. We should be sending that in the coming weeks. All right, so food resources. This is a new update. The city is now offering free meals for all New Yorkers. Previously, you may have heard that this was for all New York students, but they've changed it starting yesterday, I believe. It was yesterday or the day before. Now it's free meals for all New Yorkers. So the way that it works is that meals can be picked up at any meal hub from 7:30 a.m. to 1:30 p.m. Monday through Friday. The meal hubs will operate for children and families from 7:30 to 11:30 in the morning, and for adults from 11:30 to 1:30. No one will be turned away at any time. Parents and guardians can pick up meals for their kids. There's no registration or ID required. You can find so you pick them up at schools throughout New York City, and you can find the school closest to you who has this service using this link here, schools.nyc.gov/free meals. Also, Fresh Direct is offering free meals during this time, and there's no limitations on that either. You should see here, this link here, for where to pick up close to you. Also, food banks, which have been around for a really long time. Here are some resources that you can use to find one close to you. This one here is an interactive map. Just search by zip code. And the second link here is some guides as well to food and assistance in your area. Again, I wanted to plug applying for SNAP benefits or food stamps here at nyc.gov/access HRA as another option. All right, a little bit about mental health and staying active, because now many folks are finding new ways, new normals. So it's important to talk about this as well. So really, really great resource is something provided by the city. It's called NYC Well, and what you can do, it's free. You can speak to a counselor through phone. You could text with somebody or chat on the computer for access to mental health and substance use services in more than 200 languages, 24/7. Here's the phone number, or you could also just text the word "well" to 65173. It's a really great, quick resource. Also included some tips from the CDC, the Center for Disease Control, on managing anxiety and stress during this time. Another resource similar to NYC Well, where you can text a phone number to talk directly to a crisis counselor, is this one here. You could text SHARE, the word SHARE, to 741-741 for free, confidential, 24/7 support. And it doesn't have to be related to COVID-19. It could be about anything that you want to text or chat with somebody about. All right, about staying active. There's a really great resource by the organization called Immigrants Rising. There are virtual wellness gatherings on Wednesdays and Sundays from 5 to 6. And this organization is geared towards undocumented young people, helping them create community, stay grounded, and connect to one another. I included the link there for where you can sign up for the virtual gatherings. Also wanted to plug to make sure that folks know that SBU is uploading weekly train at home programs on our website, and coaches should be sending them out, I believe probably through Band as well. And it's on our social medias as well. As another resource is YouTube. YouTube has a lot of really great at-home workouts that don't require equipment or a lot of space. And that link will send you right to some of them. All right, domestic violence. Important to talk about because as people are at home more, not everybody's situation is particularly healthy. So here are some resources for folks. The Family Justice Center's facilities are temporarily closed, but services remain available by phone, and I've included the numbers for all the boroughs below. So resources available through them include immediate safety planning, shelter assistance, and other resources. There's also the 24-hour domestic violence hotline through New York City, that 800 number. Or you could visit the Hope Resource Directory, and again, NYC Well. And of course, in an emergency, to call 911. All right, I wanted to take some time here as well to plug the importance of the census 2020. The census is here, and this represents a once-in-a-decade opportunity to ensure that our communities will get the resources and representation that we need. Also, this is the first time in history that the census will be available to everybody online and through the phone, which makes it really easy to do. The money that we receive through this census goes towards schools, housing, roads and bridges, health, and a lot more. Something that was a little bit controversial about the census before was the citizenship question. There's no citizenship question in the census. And your information is confidential and can't be shared with anybody. That includes law enforcement, the government, or your landlord. And you can fill it out by going to my2020census.gov. It's really fast and quick and easy and important. All right, so now we're going to go to the Q&A portion. Because we're on Facebook Live, I'm going to take a minute to connect with my colleague who's been monitoring comments. And I will answer some questions that have been submitted. I know that some may have been submitted through other channels as well. Okay, thank you, Kartika, who is sending me some questions. All right, so the first is, do I help people with getting unemployment benefits, or where do they have to sign into? Okay, so I will navigate back to that slide for the link and information on how to apply. Okay, so here's the slide on how to apply. To answer the first part of the question, if I help folks with getting unemployment benefits, yes, that's something that I can do. Again, like I said in the beginning, we're giving priority to families who are already involved with SBU in some capacity. However, if that's not your situation and you would still like help, please still reach out to me. And based on our capacity, we would be happy to help or connect you with somebody else who can help you navigate this process. That is, it is complicated. So here is the link again. I'll say it. It's labor.ny.gov/unemploymentassistance.shtm, or you can call them at 1-888-209-8124. And please do take note of the filing hours. The filing hours here, and the fact that you need to file based on the first letter of your last name. So here are the days. Here, A through F, file on Monday. G through N, file on Tuesday. O through Z, file on Wednesday. But if you miss it, you could do Thursday, Friday, or Saturday. I'll leave that for a moment, and then also I will go back to the screen that includes my contact information. So if you'd like to reach out to me to schedule an appointment, I would be, or ask me any further questions, I'd be happy to connect with you. Let me get to that. All right, here's my contact information. You can call me or text me at my cell. You can call my office number or send me an email. And again, for those who would like a copy of this presentation, and I'll also include a document with written answers to all of the questions, and also more resource guides. If you'd like all of this sent to you, please enter your information at bit.ly/SBU webinar. All right, the next question from Kartika, thanks so much, is rent going to be suspended this time? Okay, so evictions have been halted now until the courts choose to open again. So it's not that if, let's say, for example, you can't pay rent this month in April, it's not that at this moment you don't have to pay at any point in the future for April, but if you can't pay, your landlord also can't take any action against you. So they haven't been necessarily suspended, but they've been paused. There is some advocacy going on to suspend payments, to lift them for April and May, as long as this is going on. But right now, as it stands, it's basically just paused. So if you can't pay for April, you shouldn't be concerned that your landlord will take action against you. You can't be evicted. You can't be kicked out. Your landlord can't do anything against you. But they aren't lifted either. All right. The next question, do people who without a social security number qualify for any kind of financial assistance? Okay, so there are options available to those who don't have a social security number. Let me navigate back to my slide about that. But I will say, while I'm finding the slide, that if you don't have a social security number, you aren't able to apply for unemployment benefits, and you also won't receive the stimulus payment. However, you are eligible for a few things. Here's the slide. Okay, or there are a few things that you can do. The first is to call your bill collectors and tell them that you've been impacted by coronavirus and ask what they're offering. Also, like I said about the rent, the state has halted evictions. There are some funds available for undocumented folks, and here's a list of some. UndocuFund, One Fair Wage, New York State Youth Leadership Council. If you'd like to tap into those, last time I reached out to them, they were already depleted, but I can still reach out to them for you, so please reach out to me. Happy to do that and help you through that process. Also, if you have children who are U.S. citizens or legal permanent residents, in terms of financial assistance, you can apply for SNAP and emergency cash assistance. The emergency cash assistance has been expanded due to coronavirus. So that's money that you can spend on anything. It's cash. And these benefits won't make you a public charge because you're applying through your citizen child or a legal permanent resident child. To apply for that, you go to nyc.gov/accesshra. Okay, the next question is applying for unemployment a public charge for someone who wants to adjust status later on? No, so applying for unemployment does not count as a public charge. I'm trying to find where I included that on my presentation. I can't find it, but the answer is no, it's not considered a public charge. All right, and then the last question, something that I believe was also asked yesterday. Does someone who receives Social Security income qualify for the $1,200? So that's something that I'm going to have to look into a bit more to answer. However, I can say that if on this slide here that's on the screen, if you're receiving, I'm reading from the bottom, if you're currently receiving disability, retirement, or unemployment payments, you will still get the stimulus, the $1,200. But for SSI specifically, I will have to do a bit more research on that. But it will be included when I send all of this stuff out. So again, please make sure that you enter your contact information at the bit.ly. All right, I believe I'm getting a few more questions, so I'll take a bit more time to do that. Okay, so next question, if you go to the emergency room with the virus, will I have to pay the bill afterwards? Okay, so I'm trying to find my slide. So for those who, okay, so for those who are low income or don't have health insurance, for example, coronavirus testing, evaluation, and treatment in New York State, the payment has been waived. So if you are low income or don't have health insurance, the governor has directed healthcare providers to waive any cost for obtaining a test, including the ER, urgent care, and office visits. Receiving a few more questions. Okay, the next question is about the small business loans eligibility. And the question is, do I need a tax ID number to qualify? The answer is no. You don't need a tax ID to qualify. Let me pull up the resource again if you would like more information on this. Here it is. fmaonline.net has a lot of really good guides. And I would suggest that you go there to get some more information, but no. Alrighty, I'm getting another question. Okay, so I'll go ahead and read this. This is a comment from somebody who's viewing. They say that their understanding is that people who get Social Security will get the stimulus, but they need to file a tax return and that there will be a special form on the IRS website for people who don't normally file. He says he's not 1,000% positive, but he thinks he has it correct. Thanks a lot, Dwight. That's some good info for folks to look into for whoever had that question. You should check out the IRS website and see if you can find a special form or any other information. I'll also be sure to do some research into this and include it when I send out the materials. Thanks, Dwight. All right, just waiting to see if there's any other questions. I think there is. Okay, another question on the stimulus is, if I filed taxes with my husband, will the stimulus check be $1,200 each or per household? The answer is each. Sorry for the clicking back and forth, but I just want to make sure that people have all this information. So it's per adult. If you earn less than $75,000 per year, the payment is $1,200 per adult. And then for any child age 16 or under, qualifying child for age 16 or under, you receive $500 more. And then I guess something else that I should clarify is about head of household. So for taxpayers who file as head of household, you'll get the full payment if you earned $112,500 or less. All right, so I'm told there aren't any other questions. If anybody does have questions, please do type them in the comment section now. Kartika, my colleague, is monitoring the chat. Thanks a lot, Kartika. I really appreciate it. I'll just hold on one more minute to see if anybody else has questions. Let me, in the meantime, go back again to my contact information for anybody who wants to reach out. Again, if you're not part of the SBU community, you should still feel free to reach out to me. And if I'm not able to help you directly, I am happy to connect you with somebody who can. And please enter your contact information if you would like these resources sent to you at bit.ly/SBU webinar. Okay, one last thing from Dwight. Dwight, thanks so much. That he understands that the form isn't on the website yet, so folks will need to monitor that to see when it becomes available. Okay, great. That's very helpful. Thanks, Dwight. Again, I'll be sure to include this when I send all of this information out at the end as well. All right, it looks like we don't have any more questions. I'll leave my contact info up for a minute more, but thanks so much to everyone who's joined, and be on the lookout for this information to be sent out at a later time, definitely by Monday. Thanks a lot for everybody for tuning in. All right, thanks everyone. I'm gonna go ahead and end the live. Have a good night. Have a nice weekend, and I hope to be in touch with some of you soon.